All right, so we'll get to talk about one of the most popular surgery as far as childbirth is concerned. So this is what is known as a cesarean section. Cesarean section. So it usually abbreviated as what? C-section. Okay. So you just have to do it. Maybe the mother can't deliver through the vagina, so I just have to just cut around the side. You can notice how the line is cut. It's not straight though. It's a C-shaped. Alright. So there are reasons why the cut is C-shaped, so that it's along the lines of the skin, so that when they you can recover, there's a minimal scar. So a cesarean section is a surgical procedure. So it's used to deliver a baby through incisions in the abdomen and the uterus. So they are cutting the mother down to bring out the baby. Now see reasons why this surgery needs to be done. Okay. So the baby is coming out through the abdomen rather than the vaginal canal. So it can be planned or performed emergently when complications arise during labor. So look at this. Sometimes it could be that at all the woman can't give birth through the vagina. Sometimes it could be that she could give birth through the vagina. Labor started though, it was fine. Later on, complications came in. Maybe the baby hooked somewhere, you understand? So now, reasons, very important. Of course, if you ask you any question about cesarean section, it's always the reason. So if the labor is not progressing, you have a labor that is paused, it's stalled, your labor is too long, she has pushed too long. If the baby is distressed, so they have some abnormal heart rate or oxygen concerns, placenta previa, that's placenta is blocking. Like, the baby's head is supposed to come out first. So if you have the placenta dropping to block this place where the baby's head is supposed to pass through, no other option than cesarean section. Is breached or transverse presentation. So if the baby is supposed to present with the head first, so if the head is not presenting first, there's a problem. So multiple pregnancies, sometimes twins or triplets, the mother has to push to be too tired, right? So cesarean section. Previous cesarean section. So the mother has had this history of using cesarean section. So maternal health issues. The mother is not really strong for labor. So how does the procedure work? All right. So anesthesia. So you give anesthesia through the spine or epidural. She's awake, but she's numbed. You guys are doing things in the lower part, she's not aware of it. So incisions that a horizontal cut is made in the lower abdomen, bikini line. If you wear your bikini, that's where the top of your bikini should be staying. So they call it bikini line. Okay. So delivery, the uterus is open, the baby is delivered through the incision. Closure, the uterus and the abdominal layers are stitched closed. Entire procedure typically takes about 45 minutes to about an hour. Right. So risk, bleeding, infections, blood clots, all right. Injuries to some organs, you should be careful, right. Breathing issues in baby, right. Could be that delivery will be too early, So after the surgery, breastfeeding can usually begin soon after the surgery. Walking is encouraged within 24 hours, right, so that you're hitting back to exercise and all of that. So follow-up care includes incision checks and emotional support.